Before you go, you couldn't take a look at this badly, could you? I mean, Dave's busy on a reduction.
I was hoping to put my head down.
It'll only take 5 minutes.
Hello, I'm Dr. Roger. What seems to be the problem?
Well, she was crying all night, and then she started being sick this morning.
What does she vomit?
Her feed.
Standard baby sick. There's a bruise on her arm.
Well, I don't know where that came from.
Are you Hayley's father?
No, I'm Louise's boyfriend.
Do you know anything about the bruise?
No.
I'll be back in a second. Excuse me. Could you bleep the paediatrician on call, please? Thanks. What? What?
Don't say you've forgotten, mate.
Cricket, it's today. Nasreen wants me to see that poxy new costume drama.
But those things are all full of pasty-looking women. I reckon they're all anemic from heavy periods.
Yeah. Maybe that's why they're called period dramas.
I'll tell her we'll go another time. I'll be out as soon as I referred this baby to paediatrics.
Heard that one before.
I will be there.
Promises, promises.
Nasreen wants me to see more of each other. The lads want me to hang out with them. I mean, when do I get to do what I want?
Nasreen just can't do without you, mate. She's only flesh and blood, after all.
Yeah.
You know what I mean? Why is he still pretending to be one of the lads when he's obviously not? Thought I was supposed to be the pup. Morning, Dr. T.
Gent.
Bleeps on the blink.
Phil, I didn't realise that you were so close to hearing whether or not you're going to face any charges.
They say there's a good chance that I'll be up for manslaughter.
I'm sure that understandable anxiety was behind our recent conflict.
No. I trusted you to look out for me. Look, I helped you. Can't you see it's a simple matter of right or wrong? Forgive me, Dr. Turner. I need you to help me. I need you to help explain how that patient died.
Your testimony was unequivocal, Phil, that you didn't seek senior advice. You even tampered with the medical records to prove it.
Under duress from management and you.
To change your story now would only serve to add perjury to any charge against you.
Dr. Turner, you're forcing me to point the finger at you.
Forcing a case of your word against mine. My sincerest advice to you, Phil, is to think this matter through more carefully. For your own good.
The monitor, the monitor. It's here. Thank heavens you're here. He's not got a Benflon, Doctor.
Shouldn't someone be bagging him?
And your bag.
I'm getting cardiac massage. Where's the anaesthetist? They put out a call to him. My SHO's where's on the other side of the hospital.
There's a connection missing on the bag.
We're getting a trace. Do you want to shock him?
Is there no adrenaline out?
Did you get that Benflon in?
Come in. I'm sorry, Mr. Docherty. I wanted to have a word, please.
Of course, Phil.
I'm sorry, I didn't know who I could tell. I didn't know who could help me.
We should give lignocaine, I think.
Sorry, my bleeper's on the blink. Why is no one doing chest compressions? And the ambu bag should be connected to oxygen, sod the lignocaine. You're not applying the correct protocols. Has he had atropine?
No.
Atropine 3 milligrams, 1 milligram of adrenaline. I'm sorry, am I annoying you?
I was wondering if you were still allowed to get this close to patients.
Sorrow's down on Jerry's.
Count them down 5 to 1.
1.
Asystolic arrest, random use of
3,
shocks and drugs, now
4,
applying first
5,
proper cycle of CPR.
1.
Well, let's keep it going. Another adrenaline, please, thank you.
4, 5. 1, 2, 3, 4, 5.
I'm sorry to have dumped this on you, Mr. Docherty. I quite understand if you don't want to get involved.
I'm sickened, Phil. Sickened this was ever allowed to happen. But there'll be a way out of this. On that you have my word. Now you go out there and play. You leave this to me.
Okay. Thank you, everybody. Liz, don't go just yet.
Nasreen, please, listen. I forgot the cricket match was today. I'm really sorry, but I don't see why we can't go to the pictures tomorrow.
I promised to see Mum tomorrow. I don't want to let her down.
Okay. Okay, with any luck, the match will be over by this evening. I won't have a kip. I'll take you out instead. I can't say fairer than that, can I?
Oh, you're a love.
Thank you.
I do love you.
Yeah, I do too. Bye.
Oh,
Sorry.
that's okay. I'm Amanda Harding, the paediatric registrar.
I think I've got a non-accidental injury for you.
Let's have a look.
Patrick, have you got those notes, please?
On the baby?
Yeah.
You ought to follow through more with your bowling action.
She's a well-looked-after baby, not even a nappy rash.
It's not what you'd expect if this was non-accidental.
I was hoping to get to the cricket. You okay to carry on from here?
Sure.
Dr. Harding, contact school.
Sorry. I've got a really prem baby on the unit. Do an x-ray, will you, and I'll be right back.
We did everything that we could. But we weren't able to revive him. I really am very sorry.
Liz, I have been through it myself. I am not trying to get at you, but you need some teaching in resuscitation skills.
I don't see why you're picking on me. Didn't you read that thing in the British Medical Journal? Only a minority of doctors who were more senior than me knew how to conduct a proper research.
Which is all the more reason why we should deal with poor training when we find it. Look, either you speak to Dr. Hudson or I will.
Paul,
How did it go?
I've been suspended too.
I'm sorry.
At least when you lose your job, you can go back into industry.
I did try and save you.
Motivation, guilt. Result, futile gesture.
Mr. Randall, is that a comfortable night? Do we have an ECG, please, Liz? Hello.
Thanks.
High takeoff.
I wondered about pericarditis.
Well, this ECG isn't pathognomonic, but it's a good thought. Thank you, Liz. Is the pain better or worse if you sit forward, sir?
I don't think it's any different. I feel fine now. I was hoping to go home.
We're doing some blood tests to see if there's been any damage to your heart. You shan't go home until we're satisfied there hasn't been any.
Do you sit forward for me, please, sir?
Is the consultant going to see me?
She just has. Yeah, you can go home today if your blood test is normal.
Yes, Dr. Hudson.
I'm sorry. I thought,
I thought, what?
Yeah, what?
Yeah, what?
Wait a minute. I think that's it.
You must have had a quiet night.
Rough morning, though.
Good. Shall I see you all at the cricket match, then?
Yep.
Yes. My husband and elder brother are making up the numbers in the consultants team.
Well, we'll be there.
Good, thanks.
Dr. Hudson?
Dr. Hudson, I wanted to ask you something.
Yes, certainly.
I wondered if it would be possible for me to do a course in advanced cardiac life support.
Do you have cause to worry about?